Next, we will be hearing from Jocelyn Samuels, who is the new director of the Office for Civil Rights. When we talk about consumer engagement and healthcare, often the first thing folks think about, or many folks think about or used to think about, is the privacy of that health information. The HIPAA privacy rules have been in place for over a decade, and while people think about the protections that came with the HIPAA privacy rules, I think the most powerful thing that the HIPAA privacy rules did was some of the patient's rights, particularly granting a consumer the right to access their own health information. I remember talking to a group of doctors in the early days right after the rules were passed, and this was actually seemed to be shocking that patients should be able to get copies of their records because the doctors that I spoke with saw that those records were their own records. And I think it really was the beginning of a culture shift where doctors and patients have a part to play together in reviewing the information, in sharing in the treatment decisions, and for patients to be engaged with their clinicians. So, as I mentioned, Jocelyn Samuels is a new director of the Office for Civil Rights, which is the office that is responsible for developing, interpreting, and enforcing the HIPAA privacy and security rules, among many other things. Prior to her tenure at the Department of Health and Human Services, Ms. Samuels was at the Department of Justice. And prior to that, she was vice president for education and employment at the National Women's Law Center in Washington, D.C., where she was engaged in legislative and policy advocacy to promote enforcement of Title VII and Title IX. She also previously served as labor counsel to the late U.S. Senator Edward Kennedy and as senior policy attorney at the Equal Employment Opportunity Commission. Please join me in welcoming Jocelyn Samuels.
Well, thank you, everyone. I'm so happy to be here today. As you can undoubtedly tell from the letters after my name, I am not a doctor, but I have been a patient, and I know how important, and if you ever had any doubt, Emily's story would tell you how extraordinarily important access and empowerment is for patients around the country. So I am really, really delighted that this, my maiden speech on HIPAA topics as director of the Office for Civil Rights, is in the context of this 4th annual Consumer Health IT Summit and with all of you in this room. I'd like to thank ONC for their partnership. They have helped to pave the way for consumer engagement in the world of emerging health technology and are real leaders in our efforts to ensure that all consumers are empowered to manage and improve their own health through electronic health records. I'm also delighted that the right to access is front and center in this meeting, and I'll be talking a little bit more about that as I go forward. As you know, the Health Insurance Portability and Accountability Act of 1996, fondly called by some HIPAA, protects the privacy and security of individual health records. Importantly, for purposes of consumer engagement and participation in healthcare, HIPAA also guarantees that individuals and their personal representatives can see and get copies of their medical records. That right to access, which applies whether health information is stored on paper or electronically, is critical, as you have heard today, to enable individuals to play a more active role in their health care, to manage their treatment decisions, and to improve their relationships with their healthcare professionals. So let's talk a little bit about how HIPAA helps to make that happen. Obviously, for these reasons, the right to access personal health information is the cornerstone of the privacy rule under HIPAA. OCR, the Office for Civil Rights at HHS, enforces that rule, and we are committed to strong protection of the rights it guarantees. In fact, we've recently strengthened patients' rights to access in 2 important ways. First, patients now have an express right to gain access to their electronic medical records. Second, patients and their personal representatives soon will have greater rights to get their lab test results directly from the laboratories rather than through their providers. They will certainly still be able to get those results through their providers, but changes issued last February in coordination with CMS and CDC give patients a new option of getting their test reports directly from the laboratory. The deadline for laboratories to comply with these new rules is October 6th, so just a little over 3 weeks from now. And we'll be speaking more in depth on this topic this afternoon on a panel discussion if you want more information. We look forward to working with our many lab partners around the country as these rules are implemented and count on them to ensure a smooth patient experience. We're also counting on all of you here today to help to get the word out to patients about their rights and about how to access their medical information. Access to information, as we've said, can enable patients to track their progress, monitor their lab results, communicate with their treatment teams, and adhere to their treatment plans. But patients can only do this if they know that they have the right, and you are critical partners in the effort to ensure patient education and empowerment. Here's how OCR can help. We have a number of tools on our website that can provide information for both consumers and providers so that they can learn about their rights. For example, we have a series of 10 videos on our YouTube channel that explain patients' rights and covered entities' obligations. We're just shy of 2 million views. 2 million is a lot, but it's not enough. We need to get the word out about those. At the last IT Summit, we issued a letter clarifying patients' right to access to their electronic health information. That letter is on OCR's website, and we can provide links to those of you who'd like to pass it on. We also have an Information is Powerful medical campaign, Powerful Medicine campaign, which was awarded the 2013 Secretary's Meritorious Service Award, which is the second highest award that the department offers. The campaign aims to increase awareness of HIPAA rights and benefits among HIV-positive Black men who have sex with men, people who we've referred to by the acronym MSM. Black MSM continue to be disproportionately affected by the HIV epidemic. Although they comprise only 1% of the U.S. population, they represent 25% of new HIV infections. That's why we have directed this campaign specifically at them, presented it at Black Pride events around the country, and maintain all kinds of materials on our website so that we can provide tailored information and encouragement to people who are vulnerable to HIV and its terrible impacts. We also have 4 consumer brochures on our website. One is called Your Health Information Privacy Rights. Another is called Privacy, Security, and Electronic Health Records. A third is Understanding the HIPAA Notice. And the fourth is Sharing Health Information with Family Members and Friends. These aren't catchy titles, but they are really important documents that provide important information for consumers on both what their rights are under the law and how they can exercise those rights. They are available on our website in 8 different languages, and I encourage you to disseminate them widely. That's part of the way that we reach out to consumers, but we're also anxious to ensure that we reach out to providers so that they understand how to comply with their responsibilities under the law. So we've worked with our partners at ONC to launch a model notice of privacy practices, which has been downloaded more than 200,000 times. Again, great statistic, but the more broadly we can circulate this, the more helpful we can be to providers who want to ensure that they are in compliance with HIPAA. The tool is a plain language document available in both English and Spanish so that providers can educate their patients about their rights to their information. It's a tool under the privacy rule to get the word out, and we are happy to make it available as broadly as possible and hope that consumers will find it both easily understandable and fun to read. We also have a resource center at medscape.org, which is called Protecting Patients' Rights. That document works to ensure that providers have access to important training materials with the right information at the right time. Whether it's on a tablet, a smartphone, or a PC, providers can link to OCR's guidance materials and tools to help them comply with the rules, all available on an easy-to-access mobile platform. Somebody told me to say that. I don't know what an easy-to-access mobile platform is, but for those of you who are more sophisticated than I'm sure that's something good. We also have training programs that are available for providers also on the medscape.org site. And those are training modules that educate providers about best practices to comply with HIPAA, including mobile device security, privacy requirements, risk analysis, and ongoing risk management, and, of course, patients' rights. All 6 modules are available for free continuing medical education and continuing medical education credit. Let me just say one thing about our enforcement responsibilities, because obviously we want to do our best to encourage voluntary compliance and to ensure that providers and others understand their responsibilities and comply. That said, when faced with non-compliance, we will take enforcement action. I'm getting all choked up about our responsibilities. We take this responsibility very seriously, in part because of the number of complaints that we receive. In fact, complaints about lack of patient access accounted for 1/3 of the HIPAA complaints that we receive. So it's clearly a right that consumers pay a lot of attention to and are worried about protecting. That said, we also get significant numbers of complaints that allege noncompliance under the privacy and security components of the HIPAA rules. We investigate those complaints. We work with the providers to see if we can voluntarily remedy the situation, but we do take, as I said, enforcement action as necessary. So, for example, we have entered into settlement agreements with Parkview Health System, which we investigated after employees left 71 cardboard boxes of medical records unattended and accessible to unauthorized persons on the driveway of a physician's home in a heavily trafficked area. We recently reached a multi-million-dollar settlement with the New York Presbyterian and Columbia University hospitals after a lack of technical safeguards resulted in the information of 6,800 patients being accessible on internet search engines. And finally, with Affinity Health Plan, we reached an agreement when the protected information of up to 345,000 people was left unsecured when the plan returned multiple photocopiers to a leasing agent without erasing the data contained on copier hard drives. All of these settlement agreements are available on our website because they offer important educational tools for providers about some of the problems that continue to occur even more than a decade after the enactment of HIPAA, and the ways in which they can get themselves into trouble. And I urge people to be alert to all of the requirements of the rule to avoid these kinds of breaches and problems that can result in real harm to patients and sanctions for the providers who've engaged in the conduct. Let me just, in closing, thank you again for the opportunity to be here and say that obviously patients' right to access is a critical component of reinventing healthcare delivery by involving patients directly in the management of their care in an ever-expanding digital age. We're serious about protecting consumers' right to access for their healthcare information, and making sure that they know their rights. We look forward to working with all of you to ensure that the promise of the law becomes a reality as technology improves and as we work together to ensure better health care for all Americans. Thank you very much.
Thank you so much, Jocelyn, for your remarks.